Well, President-elect Trump sharing his ideas for repealing and replacing Obamacare in an interview with the Washington Post. Trump telling the paper, quote, "We're going to have insurance for everybody." There was a philosophy in some circles that if you can't pay for it, you don't get it. That's not going to happen with us. It will be a much simplified form, much less expensive, much better. Joining us now to weigh in, Manhattan Institute Director of Health Policy, Paul Howard. Paul, welcome to the show. So Donald Trump, President-elect, says that he's got a plan formulated down to the final strokes, and it includes insurance for everybody. What does he mean?
Well, it's not clear. Until we see the actual details of the plan, what he appears to be saying is he's going to have comparable coverage to the Affordable Care Act, Obamacare, and he's going to, as he said before, make sure that people who have pre-existing conditions get covered, and that means this is going to be a relatively expensive plan in the ballpark of what the ACA is, unless he finds other ways to bring down costs. What he alluded to is fewer insurance mandates on the insurance company and perhaps some other tweaks that can help bring down those costs.
Well, it's clear as mud right now. I mean, I read the whole story. I tried to understand it. You know, he's always negotiating, so that could be part of it. But one of the interesting things is sort of the tension between providing insurance for everybody on the one hand, and on the other hand, the Republicans want to make sure that these costs don't spiral out of control. Can you do both at the same time?
Look, I mean, the Republican concern about Obamacare was it was an expensive government power grab that was going to collapse, and it's collapsing. So I think one thing the Republicans could think about in this area is kicking more of this responsibility back to the states. That's where doctors and hospitals are licensed. That's where the biggest costs are. So if you set a predictable framework for them and then drive competition through them, I think you can do both.
I do want to mention these numbers. Premium subsidy spending is on the rise, up about $10 billion. Take a look at those numbers.
Wow.
So we're already seeing this spiral out of control. But it raises the question, can you repeal and replace at the same time? That's what Donald Trump is pushing for. That's what the Republicans have said they don't want to do. Paul.
You've only got 52 votes in the Senate right now. So if you lose 4 or 5 of those votes, if you peel off either their Republican moderates like Susan Collins or conservatives on the other side, you're going to lose reconciliation. That's an awfully tough needle to thread, and that's why they originally were going to go with repeal and delay instead of simultaneous repeal and replace.
Well, needle to thread. We'll be watching it. Paul Howard, thank you so much.